Good day, my name is Paul Jarrett. I'm an orthopaedic surgeon, look after people with shoulder problems as well as other upper limb problems, and I was wanting to talk to you about shoulder instability. Now, every joint in your body that moves has a number of structures to move it and another number of structures to prevent motions it's not meant to do. And if you think about your shoulder is an extraordinary joint. It has this huge amount of motion that's more than half a sphere, and so that's an incredibly mobile joint. Now, people often talk about the shoulder joint as being a ball and socket joint, but if you think about that, it can't really be a very deep socket. It's got to be a very shallow socket, and the reasons for that is if it was a deep socket, as you moved it, you'd find that the bone impinged and prevented too much motion. And so for your shoulder's got an incredibly shallow socket to allow all that motion to occur. And therefore, in order for your shoulder to be stable, it's principally the ligamentous structures round about it that keep it stable in combination with the muscles, but the ligaments are extremely important and more so than a lot of other joints. Now, if you put forces through your shoulder that exceed your shoulder's ability to remain in joint, it's possible for you to dislocate your shoulder, and then when your shoulder goes back in joint, those structures, those ligamentous structures which were injured by definition to enable your shoulder to come out, often they will heal, but often they won't heal particularly well. So that for some people, they'll find that when their shoulder is recovering, it remains unstable. So either it feels wobbly or that they dislocate again. And it's quite age dependent. If you're young, so if you're under the age of 25, the risks of redislocating after a shoulder dislocation are actually really very high, particularly if you're under 18. Whereas if you are older, like myself, and you dislocate your shoulder, the risk of it redislocating is much less. Often the main risk is in fact of your shoulder becoming stiffer. Now, if you were to look inside your shoulder, this is a picture here. So there's your arm bone there with the cartilage on the top of it. This is your shoulder blade here, so that's a socket. And you've got your capsule around here, which isn't shown in this picture. A capsule is like the ligaments all going around it. Often what will happen in a shoulder dislocation is your labrum, which is a cartilage attached to the side of your shoulder socket. Often it becomes torn away, and that can be one of the reasons that your shoulder remains unstable, because that's not attached properly. Now, if you dislocate your shoulder and you come into hospital, usually your shoulder will be put back in place, and then the decision is, well, how would it be best treated? And for a lot of people, the best treatment is simply to use a sling for comfort until it feels comfortable enough, then start coming out of the sling and using it, potentially having some physiotherapy, and see how things go. For a smaller group of people, even after a first dislocation, it may well be worthwhile doing an operation and stabilizing it. So if you're a very high level 18-year-old athlete and you dislocate your shoulder for the first time, you can make a very strong discussion for actually having it repaired straight off. However, for a lot of people, we'll run with it and see how things go. But certainly if it becomes unstable after that, if you have further dislocations, then the likelihood of it continuing to be unstable is very high, and so usually we would suggest doing an operation. And if we do an operation, what we do is we tend to put a telescope in your shoulder, we have a good look around, we look and see what structures you've injured, and then try and repair them, trying to return those structures as close to how they were originally as possible. And so if with this labral injury, and this particular labral injury is called a Bankart injury, what we tend to do is free that up, put that back to where it was on the shoulder blade socket, and stitch it back in place. And for that sort of operation, typically people are in hospital for a night afterwards. They're in a sling for about 4 weeks afterwards, and then we get the physiotherapist to help you start rehabilitating your shoulder. But it does take a while for it to recover fully, and in particular what we're doing with an operation like that is wanting those tissues to heal back. And of course, healing doesn't happen overnight, and so we have to get you to be careful with your shoulder for a bit. So we wouldn't suggest people do heavy things with their shoulder for about 3 months, and we wouldn't suggest doing very high level contact sports, particularly football, for often about 9 months afterwards. So they're the main options regarding shoulder instability, and I'm looking forward to seeing you in the clinic, and we can discuss what's happening with your shoulder and what the options might be for you. Thank you.